You think you're safe. You trust that global health is in good hands. But what if the organization meant to protect us has flaws? What if the next pandemic catches us off guard again? The World Health Organization shapes global health policy, fights disease, and leads emergency responses. But its impact isn't just political, it's personal. Today, let's uncover the truth about its power, its challenges, and what it means for all of us. All right, let's talk about the World Health Organization, the big boss of global health, the referee in the world's never-ending boxing match against disease. Since 1948, this United Nations-backed powerhouse has been keeping an eye on everything from pandemics to whether your favorite snack has enough trans fats to kill a horse. Their goal? To make sure everyone everywhere has a fair shot at staying alive and ideally healthy. They've been at the forefront of disease control, tackling everything from polio to COVID-19, and their global surveillance systems are basically the world's health security cameras, spotting trouble before it turns into a full-blown crisis. But it's not just about outbreaks. World Health Organization also fights the slow killers like heart disease, diabetes, and even mental health issues. They've got campaigns for everything: vaccines, tobacco control, suicide prevention, you name it. Their vaccination programs alone have saved millions of lives, teaming up with groups like UNICEF to make sure life-saving shots reach the most vulnerable. Meanwhile, their policies on non-communicable diseases are trying to get people to live healthier lives. Because, let's be honest, if left to our own devices, half of us would be running on caffeine, stress, and sheer denial. Whether it's reducing trans fats in fast food or fighting tobacco addiction, World Health Organization is basically the overprotective parent of global health, constantly trying to stop us from making terrible life choices. And when governments need health policies, they turn to World Health Organization's research, guidelines, and essential medicine lists, like students cramming before an exam. World Health Organization brings together top experts to set international health standards, shape treatment protocols, and make sure countries don't completely mess up their healthcare systems. They also monitor medicines and vaccines to ensure they're safe and effective, acting as the global health watchdog that makes sure your flu shot isn't just orange juice in a syringe. Without them, access to essential medicines would be a nightmare, and public health policies would be a game of guess and hope for the best. But, and this is a big but, World Health Organization isn't invincible. They've been under fire for slow responses. Remember the 2014 Ebola outbreak? Delays there led to major criticism. And let's not even start on the COVID-19 chaos. Some say they're too political, others argue they don't get enough funding to do their job properly. Either way, they're constantly adapting to stay relevant in a world where health threats don't take coffee breaks. The truth is, when you're running global health policy, you're always going to make enemies, whether it's governments, corporations, or just people who really don't want to give up their bad habits. So where does that leave us? World Health Organization's work is crucial, but it's only as strong as the support it gets, from governments, from healthcare workers, and from regular people like us. Whether it's getting vaccinated, supporting public health campaigns, or just staying informed, we all have a role to play. Public health isn't just something handled in Geneva conference rooms. It's something that affects every single one of us. And the more we engage with it, the stronger it gets. I'll leave you to discuss in the comments. Do you think the World Health Organization is doing enough? Or does it need a serious glow-up? You can support us by subscribing if you haven't already. Take care of yourselves, take care of your loved ones, and I'll catch you soon in another video.